With continued advances in prenatal imaging, there is an expanding role for pediatric urologists in prenatal care and counseling, with many pediatric urologists reporting that fetal urology has become an increasing part of their practice. Exposure to prenatal consultations and opportunities for counseling and fellowship vary greatly. Many graduating fellows do not feel comfortable providing prenatal consultation, and there is a paucity of educational resources available to guide them during training. We sought to summarize available educational opportunities and make recommendations for a curriculum to guide fetal urology education during fellowship training. We performed a survey study in which separate surveys were created for and distributed to program directors and current pediatric urology fellows. Content included questions about opportunities in fetal urology, availability and use of resource materials on the subject, and perspectives on assuring progress to training independence and providing prenatal care. Participants' responses were used to identify common areas of weakness that could be targeted to improve fetal urology education and training programs. We used Kern's 6-step approach for curriculum development for medical education. Participant responses served as our targeted needs assessment to identify areas of concern. Specific goals and objectives for a sample curriculum were created based on the targeted needs of our cohort. Educational strategies to achieve curriculum objectives were identified based on participant responses and available resources. A total of 24 PDs and 28 fellows responded for response rates of 89 and 80% respectively. Other participant demographics are listed here. For further information on our survey responses, please check out our display poster. To our knowledge, these are all of the available resources that currently exist on the topic of fetal urology. When we asked participants what resources they were aware of that currently exist on the topic, we found that among these, the more structured and comprehensive ones were less known to both cohorts. Additional resources that respondents felt could aid in fetal urology education include a fellow's course in fetal urology, dedicated time to attend multidisciplinary clinics, and dedicated time with a GU radiologist, electronic curricula, and simulated encounters. We use these responses when forming our toolkit for objective implementation. The targeted needs assessment revealed 4 major themes: a need to increase fellow exposure to rare diagnoses, more opportunities for fellows to counsel families with fetal urologic conditions, opportunities outside of direct participation in prenatal consultation, and increased awareness of and access to the existing electronic curricula. This information was used to form specific objectives for fetal urology curriculum. Based on this information, our curriculum content was separated into 3 categories: prenatal imaging, counseling, and postnatal management. For each category, we created a series of enabling objectives, in which proficiency in the first serves as a prerequisite to success with subsequent objectives, starting with knowledge acquisition and advancing to skill development and application. We'll take a closer look at one of these categories. With each category, we created specific objectives that we felt each trainee should master by the end of training. This included baseline knowledge about particular diagnoses, the ability to appropriately describe and discuss these findings with colleagues, and the ability to independently read prenatal imaging for particular diagnoses. Recognizing that each training institution has differences in their volume and facilities, we also provided a toolkit of different means to achieve these objectives. This included options for didactics, access to online curricula, required minimums for imaging, particular time to review images, options for case conferences, and supervised reviews of imaging. These are the rest of our example curriculum objectives. Varied opportunities appear to exist within individual training programs for fellows to advance their knowledge in fetal urology. However, these opportunities are not consistent and often difficult for the fellows to participate in with the confines of their existing clinical obligations. This highlights the need for structured curricula and innovative educational strategies. Here we provide the foundation for development of a structured curriculum with the goal of equipping graduating pediatric urology fellows with the confidence and competence necessary for effective prenatal counseling.